breaking news from CBS 2.
Good afternoon, everyone. I'm Jim Williams in the CBS 2 newsroom. Governor Pritzker holding his daily COVID-19 briefing in Illinois. Let's listen in.
Good afternoon, everyone, and welcome back to our daily briefing. I'd like to begin today with our daily medical update from Dr. Ngozi Ezike. Doctor.
Good afternoon. Thank you, Governor Pritzker. Our medical update is as follows. We have 2,450 new cases over the last 24 hours out of a total of 15,208 specimens that were tested. That brings our statewide total to 58,505 total cases. Fortunately, we're reporting another 105 new fatalities, bringing our total fatality number to 2,559. To date, almost 300,000 tests have been performed across the state. As of midnight in the hospitals, 4,717 people were in the hospital with COVID-19. Of those, 1,250 patients were in the ICU, and 789 patients were on ventilators. We know that social distancing works, and it has limited the spread of this virus. And so we've continued to follow that science and encourage people to continue to stay home. We know it's getting difficult. The weather is nice. People are getting antsy, have cabin fever, and boredom affects both the children and the adults. And we all can suffer anxiety or depression, and kids may be starting to act out. So just wanted to share maybe a few ideas on additional things that you can do as you continue to stay home, while also thinking about getting some fresh air, getting outside safely, and getting your physical activity. So besides just binge watching the latest series on Netflix or Hulu, you can think creatively about maybe baking a new item and then sharing it with someone who does have to go to work every day. Continue to or start working on a garden. Perhaps you want to learn a foreign language and this is your time. Bon après-midi, je m'appelle Ngozi Ezike, je suis une étudiante de français. You can break out your board games like Monopoly or Pictionary. Maybe you can play a game of charades, even if it's on Zoom. I know in my house, learning the newest TikTok craze is definitely an item. Maybe you can set a tent outside. Write a book with your kids trying to document this really historic time. But physical activity should be prioritized. I know some of us are gaining our COVID 5 or 10 or 15. Let's try to make walking, which is our best defense as we try to curb our blood sugars, our blood pressure, as well as the physical, mental, and emotional benefits. Let's think about how we can stay physically active safely while socially distancing, wearing masks, so that we can take care of both our physical, mental, and emotional health. I know it's been hard on everyone. And I'm encouraging everyone to continue to do their best to keep the people of Illinois safe. This remains an unprecedented time, and the fight continues. Let's work together. Let's be all in for Illinois. We've done a tremendous job in this state, and I thank every one of you for your participation and your support of each other as we go forward. Let's continue the great work that we've done. And now a translation into Spanish. Buenas tardes. Comienzo con nuestro reporte médico. Hoy anunció 2,450 casos nuevos, en un total 58,505 casos. Desafortunadamente tenemos 105 nuevas vidas perdidas por un total de 2,559. Se han realizado un total de casi 300,000 pruebas para COVID-19, con 15,208 realizadas en las últimas 24 horas. A medianoche, 4,717 personas en Illinois estaban en el hospital con COVID-19 y de ellos 1,250 pacientes estaban en la unidad de cuidados intensivos y 789 pacientes estaban en ventiladores. Sabemos que el distanciamiento social funciona para limitar la transmisión del virus y seguimos la ciencia y también nos quedamos en casa, pero sé que se aburren. El aburrimiento afecta a los niños y los adultos. Los adultos pueden sufrir ansiedad o depresión, mientras que los niños pueden comportarse mal. Más de ver los últimos programas de televisión, piensa creativamente en otras actividades que pueden hacer. Aprende a cocinar una cosa nueva. Comienza a trabajar en un jardín. Aprende un nuevo idioma. Saca unos juegos de mesa como Monopoly o lotería. Puedes aprender trucos de cartas usando videos por internet. Haga una video de TikTok. Hablando de niños, podrías tener un campamento adentro o construir una casita enfrente. Escriba un libro con sus hijos sobre todas las cosas que están ocurriendo durante esta pandemia. Pero no olvides la actividad física. Algo tan simple como salir a caminar tiene muchos beneficios, y esos beneficios están físicos, mentales, emocionales. Cuando haces ejercicios, tu cuerpo libera endorfinas que dan una sensación positiva y también ayuda con el azúcar en diabetes y también con la alta presión. Ánimo a todos a cuidarse durante este tiempo sin precedentes y a pensar positivamente. Lo hemos hecho muy bien hasta ahora. Debemos seguir trabajando juntos para Illinois. Muchísimas gracias. And with that, I will turn it back over to Governor Pritzker.
Thank you very much, Doctor. I'm pleased today to be joined by two very special guests. First, Jamal Cole is founder of My Block, My Hood, My City, a youth outreach organization dedicated to providing Chicago teenagers with experiences and opportunities beyond their immediate neighborhoods. In response to COVID-19, Jamal moved decisively to redesign the program's approach while still advancing its mission, and he'll tell us more about this incredible work in just a few moments. I'm also very grateful to be joined by Neha Gill, Executive Director of APNA GHAR, which provides services and conducts outreach and advocacy across immigrant communities to end gender violence. I'm dedicated personally to moving us toward an Illinois where all residents can live free from domestic violence and where we advance equality and dignity and respect for all. The Department of Human Services for the state funds domestic violence prevention and assistance programs throughout Illinois, including counseling and advocacy, legal assistance, shelter, children's services, and a 24-hour crisis hotline. And in a moment, I'll give you that hotline phone number. These services are free and completely confidential for all residents. For those experiencing domestic violence, staying at home is often not the safest option. As these families spend more time together under the stay-at-home guidelines, violence in homes may escalate, becoming more frequent, severe, and dangerous. Recognizing these circumstances, our Department of Human Services is offering 3-month advances and more than $1 million of additional funding to provide enhanced support to those who have experienced domestic violence during this pandemic. Our state programs now offer more alternative housing initiatives, transportation assistance, food, and supplies. Domestic violence is everyone's business, and it's more important than ever to look out for your neighbors, to look out for warning signs. If you or someone you know needs help, please call our Illinois Domestic Violence Helpline at 1-877-2END-DV. That's 1-877-863-6338. 1-877-6, sorry, 1-877-863-6338. In just a moment, Neha Gill will talk further about the importance of being an ally and helping others in this time of crisis. I want to spotlight some of the amazing organizations that are stepping up for Illinoisans during this pandemic, and these are some of the most exemplary, the best of people during this very hard time. There's Morrison's Irish Pub of Alton, Illinois. After surviving multiple floods because their community stepped up to save them during those floods, they wanted to give back to their community. So they established a pop-up food pantry outside their building for area residents to take what they need and give as they can. On the southwest side of Chicago, the Brighton Park Neighborhood Council has worked to raise money and distribute financial assistance to undocumented immigrants who don't qualify for other forms of assistance. There's the Illinois Trucking Association, which joined up with the Illinois State Police and the Illinois Department of Transportation to hand out free meals to truckers who can't always find a restaurant that's open when they're on the road. Yet they do the critical work of delivering food to our grocery stores and medicines to our pharmacies. In Carbondale, restaurant owners and chefs came together to launch the Southern Illinois Collaborative Kitchen, providing meals for local organizations like the Boys and Girls Club, offering pickup and delivery to customers and supporting area restaurant workers. In Quincy, the Lutheran Church of St. John is running a mobile food pantry to help deliver essential nutrition to nearby rural communities. The Divvy Bike System in Chicago has announced another 30 days of free rides for all healthcare workers throughout the month of May. In Edwardsville, the Metro Milers Running Club got together virtually and decided to direct the funds that they had raised for scholarships to other sponsors who were hurting. And the group continues its running challenges twice a week while maintaining proper social distance. In Southern Illinois, the Hands of Hope Foundation has teamed up with area barbecue restaurants to create Operation Barbecued Hope, providing delicious dinners to frontline heroes. Volunteers at the Brookfield Zoo have teamed up in the Merry Mask Makers Club, sewing homemade face coverings for the animal care staff to wear as they work together to keep the animals cared for and fed. Of course, you don't have to be a member of any formal organization to make a difference. You can just be one person trying to do right by their community, like Dawn Baker, a mother of an ICU technician and a registered nurse herself, who made over 1,000 face coverings by hand to outfit the entire village of Riverton in Sangamon County. Person by person, community by community, Illinoisans are making a difference for one another. And to all who are listening, if you want to join this movement of helpers, you can go to our state COVID-19 website, that's at coronavirus.illinois.gov, and click on Volunteer Opportunities. From there, you can learn about how to donate your time or your skills or your funds or even your blood. Helping each other is how we will get through these difficult times and through to the other side. Thank you. And now I'd like to introduce our first speaker, and that's Neha Gill from the organization APNA GHAR. Neha.
Good afternoon. My name is Neha Gill, and I am the Executive Director of APNA GHAR. Our mission is to provide critical, comprehensive, culturally competent services and conduct outreach and advocacy across communities to end gender violence. Our focus is immigrant, refugee, and marginalized communities. We are headquartered out of Uptown with locations in Skokie and recently the South Side to ensure that we reach vulnerable community members throughout our area. Many of the adult and child survivors of domestic and family violence that we serve live in the zip codes that are the hardest hit by this pandemic, often because generations of families live together due to a combination of economic, social, and cultural factors. We are coming together with groups across the area to provide an intersectional response to the complexities our communities already face that are now compounded by this public health crisis. With the help of our state, city, philanthropic, and organizational partners, APNA GHAR is now supporting community members with safe housing options such as apartments and hotel rooms, food and transportation, household and essential items, financial assistance, masks and hand sanitizers, while providing resources, connection, counseling and emotional support, as well as legal advocacy and immigration support in the language that they are most comfortable in. Our staff speak more than 20 languages, and we have volunteer support for more languages. We have created an advisory detailing the social and economic hardships faced by our communities at this time, as well as our response and solutions to address these gaps. This and more information is available on our website at www.apnaghar.org. If someone you care about or know is hurting you emotionally or physically, please call the Illinois Statewide Domestic Violence Helpline at 1-877-863-6338, and you will be connected to safety and support. We are grateful for the partnership between the Illinois Department of Health and Human Services, Airbnb, and so many others to provide statewide safe housing, which is critically needed at this time. We also urge survivors to register with Smart 911 so that law enforcement are alerted before an emergency. And we are so appreciative of the mental and physical health support that the state has made available and continues to make available. I want to thank Governor Pritzker, IDPH, IDHS, and the entire administration for a thoughtful, coordinated, and concerted response to this crisis. And thank you for this opportunity to lift up the experiences of the communities that APNA GHAR serves. May is Asian Pacific American Heritage Month, and this year it also marks the holy month of Ramadan. We applaud Attorney General Raoul for denouncing the increase in hate crimes against Asian Americans. Muslim and South Asian communities understand what it's like from our experiences of post-9/11 backlash, and we stand in solidarity with those who are experiencing violence and trauma. Ramadan, though, is about self-reflection and giving back, and our communities are rising up to face this challenge together with all of you across our state. The Sikh faith to which my family belongs emphasizes unity and equality, and I hope that we can all hold on to these principles and when this crisis is behind us. Thank you. And now it is my honor to introduce Jamal Cole, founder and CEO of My Block, My Hood, My City.
I get to take this off. It's a good thing. So I've had a lot of time for reflection in this time of social distancing. I've been thinking about the issues that pervade our city, our state, our world, really. It seems this pandemic has shown such a bright light on so many injustices and brokenness within so many systems is blinding almost. I run a nonprofit organization in Chicago called My Block, My Hood, My City, and I always tell people to start a nonprofit you need faith, right? Our tagline is taking care of people no matter what, and if that's going to be your tagline, you better have a lot of faith. I got my home foreclosed one time trying to take care of people no matter what, right? But I'm sustained by reading, I have faith. I read the Bible, and the Bible says that, if you give a man a fish, he'll have food for a day. But if you teach a man to fish, he'll have food for a lifetime. Now, while these $1,200 stimulus checks are good for today, how are we ensuring we're helping people in the long run? I talked to a teenager the other day. He said, Jamal, I don't got a lock on my cell phone. There's no password to his iPhone. I said, why not? He said, just in case I get killed, I want the police to know how to contact my people. That statement was made by a teenager. He's not even old enough to legally buy cigarettes. He ain't thinking about his future and where he's going to be in the next 5 years. He wants the police to know how to contact his people in case he gets shot and his life is taken prematurely. That living in constant fear and being desensitized to danger, that's something he deals with every day in his walk to school, past the safe passage signs in his neighborhood. That kid is diagnosed with PTSD, and that's something that many Illinoisans deal with on a daily basis. Like, we don't need a pandemic to understand this. Think about it. People got PTSD from gun violence. You could have PTSD from coronavirus, right? They're not the same things, but the effects are very similar. And they both present a critical threat to our safety and kind of greatly increase the volume of loss we all going to experience, right? So what does this mean for us, right? What does it mean? It means that kids in Chicago don't got no hope right now. They don't feel safe. You can't create when you don't feel safe. You can't be dope when you don't got no hope. Around Illinois right now, we need some of that Jesse Jackson Sr. type hope, right? We need some of that she got her master's degree and almost dropped out of high school type hope, right? We need that I'm trying hard to love my brother type hope, right? We need that I ain't seen the red line so packed since Obama got elected type hope, right? We need that I only shot black on 75th and Cottage Grove type hope, right? We need that still I rise type hope in Illinois right now. We need hope in this state. And I want to touch on a kid, while we're talking about hope, I want to touch on a kid that threw the party on the west side. If I can say something about that. I'll talk to you like I talked to the Bucket Boys on 87th Street. I would say, hey man, if you got the wherewithal and the ingenuity to stop cars in the middle of 87th Street, spark up a conversation with a random stranger, and make a sales presentation before the light turns green, that demonstrates you got the skills to be successful. Why ain't you a pharmaceutical rep somewhere? You could be making $100,000 a year in bonuses. This kid that threw the party on the west side, you used your graphic design skills to make a beautiful flyer. You spread the flyer out on social media. You had hundreds of people show up to a party in the middle of a pandemic. That demonstrates you got the skills. Why aren't you doing event planning somewhere? I would love to talk to you about goal setting. If you don't have a list of detailed goals in your pocket right now, I can guess how much money you made at the party. Couldn't have been a lot. Having goals will change everything for you. Look, if you want to be safe in Chicago right now, kids, the youth, set some goals. Goals create a force field around you. Goals not only tell you what to do, they tell you what not to do. Think about if somebody says come to a party in the middle of a pandemic and you got goals, you're like, this ain't on my list of goals. You're not going to that party. And I'm not trying to tell this kid what to do. I don't like when adults tell kids what to do and don't give them options of things to do. But I want this to be a lesson to everybody. There's a risk in doing stuff like this for the youth, but there's also a risk in adults telling kids what to do without giving them things to do, right? So I want to close out by saying, listen, things are serious right now, man. Coronavirus don't care if you're from downstate Illinois, it don't care if you're from the north side, south side, west side, or over east. This affects us all. I want to say what the mayor says: stay home and save lives. But while y'all at home, I want y'all to set some goals and do something with your life, right? Because when this pandemic is over, and it's gonna be over, if you already got goals, you got a roadmap to what you need to be doing. So stay home and save lives, but set some goals and do something with your life. Thank you guys for having me.
Thank you very much, Jamal. That's incredibly inspirational. And I'd like to take you around the state with me when we can, because there are an awful lot of people who need to hear that message. Thank you. Thank you. Happy to take any questions.
All right. Hi, Governor. Lexi Suter, NBC Chicago.
Hi, Lexi.
Very high numbers again this week. I know a lot of that is due to more testing, but have you found any other trends or any other explanation for seeing so many more infections after weeks and weeks of staying home?
No, it really is a function of doing more testing. And in fact, what you'll find is a lower infection rate. If you do the math here of how many tests done as a denominator and how many positives as a numerator, you'll see that we've come down on average from what was around 21 or 22% infection rate to something in the high teens. So I think that's something for people to look at. The gross number of cases, of positive cases, really isn't any indication of much other than that we've done more testing. Indeed, if we tested everybody in the state, we would have a much, much higher number. Take note when you're watching television and you see the list of the states listed, and Illinois is climbing that list on the number of cases. That's simply a function of, it turns out we're now doing more tests than almost every other state. We still have a few ahead of us, but we're doing more and more testing. That is a very good thing. It's a very good sign, because more testing leads us to be able to keep more people at home who may have come in contact with those people, so that we can have fewer infections across the state rather than more.
Okay, good. Can you reiterate wearing a mask? I'm sure you've seen through Chicago today, a lot of sidewalks packed, a lot of public spaces very packed. You've said if you can social distance outside, you don't need it. Have you changed your thoughts on that at all?
No, that's still what people need to do, and I'm glad you asked. Face coverings are vital for people to wear. In fact, it may be the most important thing that you can do to save other people's lives, to keep other people from getting infected, and to protect people in your own home. If everybody does it, if everybody goes out and takes a mask with them and puts it on, make sure you've got it on when you are in public and in an area where you're not likely to be able to keep 6-foot distance, then you are protecting other people. One more thing. I notice that people don't feel like, well, gee, if I'm walking along the sidewalk and there's no one 6 feet behind me and no one 6 feet in front of me going the same direction, people feel like, why do I need to wear a mask? Well, you know why? It's because someone may be coming the direction toward you. You are going to be within 6 feet of that person for at least a few moments as you pass that person and the next person and the next person. So wearing a face covering is extraordinarily important. And I speak not just of the city of Chicago and areas that are highly populated, but even downstate where it's true that if you're not around other people, you don't need to be wearing that mask or that face covering. But when you do go shopping, if you go to the grocery store, or you're going to go into a park or something else where you know you're probably going to run into other people, you should bring that face covering with you.
Okay, thank you. Now from some of my colleagues. At CBS Chicago, the commissioner for the Chicago Department of Public Health, Dr. Arwady, said she's a little worried because it's a beautiful day and people are out. What is your plan if more people are out violating the stay-at-home order?
Well, first of all, it is local governments and county governments that should be enforcing the social distancing and wearing face coverings and so on. We need to continue to message to people that it's not acceptable to gather in large groups or to not wear a face covering. That's extraordinarily important for us to do. People need to take care of each other, and for the most part, people really are. But I know people need to be reminded. Some people make mistakes and maybe even purposely gather in groups. They think they're being defiant, and that's okay. Believe me, I understand. When I was younger, I felt like I wanted to be defiant too. This is not a moment for that. This is life-threatening. To be defiant in this moment about not wearing a face covering or gathering in large groups, you are putting others at risk and your own self and your family.
All right. Also from CBS Chicago, between nursing home outbreaks and the mental health toll this pandemic is taking, are there discussions about ways to uniformly facilitate video communications in nursing homes between loved ones outside and the elderly inside?
Many of the nursing homes, and indeed people who are working in nursing homes, are actually helping to facilitate that for the people who are residents of those nursing homes. It isn't something that the state has a program for, but it is something that I recognize is very important. And so many people have a device of some sort. Even seniors in a nursing home often have some kind of device these days, even if it's simply an iPhone or a small handheld device. So we want to encourage that because it has been a while now. We had to impose a strict lockdown of nursing homes even before the beginning of our disaster declaration in the state. We've had nursing homes not accepting even family members to visit. And I know how hard that is for people, but it's vitally important. Even as difficult as nursing homes have been as a spreading ground for coronavirus, and it's just a fact of life that these congregate settings are. The fact is that shutting them down to outside visitors has helped a lot to keep many of those homes either COVID-free or fewer infections.
All right. On that topic, this one from Alexis McAdams at ABC7. What is the state doing to curb the number of COVID cases at long-term care facilities? If people believe their loved ones are in serious danger because of a lack of care, how can they get them out?
Sure. I'd like to ask Dr. Ezike to answer that.
So very challenging question in terms of how to curb. We have our strategies, but we know as we look even to our partners facing the exact same thing across the state and even in other countries, it's still a challenge. Let me tackle the second part of your question. If individuals want to take their loved ones home, I don't think there's any rules against that. And we know that congregate care settings are difficult in terms of two people being to a room, being maybe sometimes several hundred people in a fixed location. So by its nature, it's very challenging. And if people want to have their loved ones at home and are able to take care of their loved ones, there's no restriction on that at all. And I think, obviously families can take wonderful care of their loved ones. And so full encouragement to do that if people are in a position to do that. But in terms of what we're trying to do, again, we put out the guidance before there was ever a case in a single nursing home. We started at the end of February and put out clear guidelines where we started, people said initially, oh, that's too cruel to say that there won't be visitors. And we were doing it with these these senior citizens in mind, that we wanted to decrease their opportunity to be infected by people coming from outside. So we initially put in the no visitors. We said that people have to be checked. All staff have to be checked. Anyone with symptoms, anyone with a fever. There was, questions that had to be reviewed, that you have to attest that you are safe to come to work. We wanted to decrease all the outside people that were coming in for different reasons. The group gatherings had to be stopped. We couldn't have lots of volunteer groups coming in. Again, trying to balance between, some of these social things that really help brighten people's spirits, but then things that also threaten people's lives, knowing that the vector, the way that the virus comes into the facility is through people coming from outside. The residents are there. They didn't go outside. They didn't go outside to contract that virus. So we tried to do all those things preemptively, and even with that, of course, we still have had cases. And so with over 1,100 long-term care facilities throughout the state, we're trying to identify hotspots, communities that are hotspots in which maybe there wasn't an identified case, and then we try to go in and identify what is going on in that facility, trying to identify early if there are cases of COVID infection in which people didn't know. So maybe if you can get a jump on it, thinking that maybe if you weren't actively ill, that you were maybe already transmitting the virus, if we can identify that a few days earlier, you can maybe have the chance to have infected less people. In places where there already is an outbreak, even if we identify 1, 2, or 3 cases, we are concerned that there's already many cases in that situation. And so then trying to identify staff that might have illness, trying to test all the staff and try to identify those people, understanding that we have to create staffing shortages, and then the facilities have to get creative to find other people to backfill. So again, it's a very challenging situation. We know that there's a lot of education. Sometimes we know that being able to practice the improper infection control measures, if there's some laxities on that could be a problem. And so making sure that we're in educating people as we go in and look, we try to identify areas for improvement, areas of opportunity. So all of that put together is how we're trying to curb. We know that we can't prevent all cases, but if we can mitigate, try to prevent as many as we can, that's what we're doing going forward. But I talk to my partners around the country. We're all going through this very challenging situation with our most vulnerable residents, and trying to see how we can stem or curb or mitigate, but it's an ongoing struggle.
Okay, thank you. Governor, this one from Greg Bishop at the Center Square. Protesters say economic damage from the shutdown is doing more damage to the health and well-being of families and individuals, leading to depression, self-harm, domestic abuse, lost education opportunities for children, medical procedures put off, and many other major societal problems. How do you weigh all of those costs?
Well, Greg, you're right. These are all some of the damages that are being caused by coronavirus. There's no doubt about it. So, we weigh these things in the mix, there's no doubt. At the moment, as you know, we continue to climb this curve, though at a much lower pace. The curve that has us, increasing the number of hospitalizations and ICU beds filled in our state. And it's true even in areas in southern or central Illinois as it is in Chicago and Cook County and the collar counties. So we're weighing them. There's no doubt. I want people to get back to work, and trying to find safe industries, safe ways to get people back into their jobs, whether they work in an office, a factory, a food processor, or a restaurant or a bar. These are all things that we're trying to weigh in the mix. And again, it's there's a lot of factors to consider as we're trying to reopen the economy. But very importantly, we've been listening to the CDC's guidance on this, and of course the expert epidemiologists that work for the state as well as for many private institutions in Illinois.
All right, also from Greg, with the challenges to your authority in the courts, why not have the legislature wear face coverings, as the public is now required to do so when grocery shopping or going back to work, and have them come back for a special session to clear up your authority?
They have the ability to come back, and they would, I would assume, and I would, in fact, it's required that they wear face coverings when they do so.
Right, thank you. And from Amy Jacobson at WIND Radio. In your joint statement with Mayor Lightfoot last night, you said, quote, "We must stay the course until data shows further progress in a reduction of new cases and as widespread testing comes online. We are thankful for all the new testing sites you opened up around the state, but wasn't flattening the curve based on hospitalizations, because the more people we test, the more people we will likely to have positive."
I'm not sure how that last part is related to hospitalizations, but I'll try to answer the question anyway. We still have increasing hospitalizations or flattened hospitalizations in some areas, and so we need to watch those numbers and have them coming down. Again, I would point once again to the plan that the CDC and the White House put out as a guide for, when can you really begin to look at reopening, and it's after you get through the peak. And sometimes that peak is a kind of flattening, and I've been talking about flattening for some time. Truthfully, as we've been talking about flattening and bending the curve, as I have indicated, we're still going up by a little bit. And then, maybe you would call that flat. But whatever you would call it at the moment, we're not going down, and that's what we really need to do. Hospitalization is a very important number for us all to pay attention to. ICU beds, also a very important number to pay attention to. Again, the case rate, I would look at the infection rate and not the total case numbers, and then I would look at the per capita infections in all across the state, just because you see a certain number of cases in a county and say, well, that doesn't seem like many. It may be that there are very few people who live in that county.
All right, last one from me. This is from Fox 32. Recently, we've been hearing about people who've been receiving stimulus checks in their dead relative's name. Although this is a federally issued fund, are you able to give Illinoisans some guidance on what they should do if this has happened to them?
Well, they should return those checks. As far as I understand, that is not allowed under the CARES Act and the provision of those checks. But I will certainly double check. I had not heard that, and so I'm glad to hear it. But I mean, in the sense that maybe there's something we can do about it. Certainly, mistakes are, maybe likely are being made. As the kind of the speed, rapidity with which the federal government's trying to respond here with checks is widespread.
Rebecca at Capital News Illinois. This is my semi-weekly check-in. How are you both doing in terms of the ongoing COVID-19 pandemic and after some awful protest signs Friday?
Well, thank you, and my family and I are fine and well. I will say that the people who were protesting, there were quite a number of people who seemed to have been carrying signs filled with hate. There were people carrying signs with swastikas on them, suggesting that there's, that they believe in either that they believe in Nazism or they think it's okay to throw the invective at people with a swastika. What I can tell you for myself is that I have spent decades of my life fighting against bigotry and hatred. I helped build a Holocaust museum. I've worked with Holocaust survivors. The meaning of that swastika is apparently unknown to the people who are carrying it, or if it is known, it is a demonstration of the hate that is among us. Having said all that, these were a few hundred demonstrators, and there are millions of people in the state of Illinois, really good people, who are doing the right thing, protecting each other during this extraordinary crisis. And I am so grateful to live in a state with those millions of people. So I'd like to turn it over to Dr. Ezike to answer the question first. So.
No, there's all is well with me and my family. I continue to hear about people who are more directly affected. Again, I am fortunate. I have a job and I have my health. My prayers go out every day to the people who are not as fortunate, who don't have the income and who are struggling. And so I understand how difficult this is. Everyone is bearing it differently. And so again, thank you for the concern for me, but the goal is to work for the people who are being disproportionately affected by this pandemic, and that's what we're all doing, and that's what we'll continue to do.
This is from Shia at Politico. Governor, the debate over the graduated income tax will be even more intense because of the pandemic. Can you address concerns of businesses that say it will be a greater burden on them if it's passed?
Yes. For those who are making that claim, the fact is that when you earn, if you earn lower earnings in a year, you pay lower taxes. When you earn higher in a year, you pay higher taxes. There is nothing new or changed or different about the effect of the graduated income tax during this moment than there was, 4 or 5 months ago before we knew about this pandemic. Other than that, I think it's needed perhaps now more than ever. We very much need to alleviate some of the burden on the working class and middle class and people who are striving to get to the middle class, and to also pay for the services that the state has and needs to provide, as well as to deal with the structural deficit that already existed in the state, not to mention now the shortfall that will exist as a result of the attack of the coronavirus.
Mike at Quincy TV. Governor, many protesters I spoke with in Springfield said they didn't care about the rising number of cases and deaths because they feel that COVID-19 is a hoax. There are also several protesters with racist signs directed towards you. What would you like to tell those protesters?
I think I said what I wanted to about that. I just, I'll defend to the death their right to be wrong and to say it out loud. But the fact is that, if they look at the facts and they understand that the experts are trying to protect them, and the elected officials that are standing on the right side of this are trying to protect them. And so I'm very hopeful that nobody got sick as a result of showing up at a protest and not wearing a mask and not adhering to social distancing norms.
Rich Miller at Capitol Facts. COVID Act Now, which works in partnership with Georgetown and Stanford, claims Illinois' R0 number is 1.11. You told WJPF Radio this week that it's 1.25. What is the latest Illinois number as far as you can tell?
I'll turn it over to Dr. Ezike to answer.
So the R0 at the beginning was well over 3, and as you do the mitigation strategies, obviously that's not the original R0 number anymore, and the effective R has fallen to, our last number said 1.2 something. So again, depending on what numbers you're using, but again, the point is that it definitely came down, again, thanks to the mitigation strategies, because people worked so hard to stay at home and to help limit the transmission of this virus. And so we're very proud that it came down, and we hope that it's not going to see a significant rise if people change their behavior.
Doctor, you could stay there because this next one's from you, from Hannah at the Daily Line. After about a week of a pretty big dip in the positive test rate of those tested for COVID-19, yesterday's positive test rate was back up to 21%, and today's rate is back down to 16%. Obviously, more testing is yielding more confirmed cases, but is there a way IDPH can break down more details about the people who are newly confirmed cases? Wouldn't it be helpful to know if these new cases are concentrated among healthcare workers or grocery store workers in order to both protect them and protect the uninfected public?
Yeah, no, I understand the question. There is a lot of data coming in terms of, having thousands, I think we had 15,000 come in. And so depending on where the samples are coming in from each day, if they're from a higher risk group, if we did mass testing in a long-term care facility, we know that the rates of positivity, if there was an outbreak there, would obviously be higher than if we had a drive-through where we had people who didn't necessarily have symptoms, but felt that, they had risk because of some of the work they do. So again, it depends on whether samples are coming in each day. We don't even have the time. When I get the information from the last 24 hours, that's not even enough time to be able to figure out how many healthcare workers, how many, to break it down like that. But I know it's important to understand how many healthcare workers have been affected. We've been sharing the long-term care facility numbers. Again, we will continue to update the long-term care facility numbers and show you that that is a significant proportion of the cases and unfortunately of the fatalities as well. So we'll continue to be as transparent as possible.
Kelly at Block Club for the governor. Some legal analysts have said you could lift the rent control ban using powers from the Emergency Management Act. Have you explored doing that?
Well, as I've said, this is something that's been in place for many, many years. Even if we said that we were going to lift it, it would, when the emergency ends, when the disaster declaration ends, it would end. So that right now is scheduled to be May 30th. It may, there may be a continuation, but it would be a very temporary thing that would have very little effect if I lifted it, because it would go right back in place if we no longer had the emergency in place.
Jake Griffin at the Daily Herald for Dr. Ezike. The governor has made his feelings clear about antibody tests. Can you describe any benefit these tests may have? And since the labs say they are reporting the results of these tests to the state, what are you doing with them?
Yes, so I know there's a lot of excitement around the antibody test. We would love to be able to say definitively that the results of this test state that you have been exposed and that you have immunity. We've already heard from the World Health Organization that we're not sure exactly how to interpret the results. So we have to be tempered in our response to the test, but as people get tested, as we learn more, as we go forward, we'll be able to make more deductions. If we see people who had positive antibodies, we'll have to figure out what level of antibodies was protected. So if you had a certain level and then we see that that person goes on to have another COVID infection, that would suggest that that level was not protective. So not having the full data, but we will continue to amass it as more people are getting the antibody tested. That's how we'll be able to make useful deductions and be able to go forward and be able to interpret this important information.
A.D. Quigg at Cranes. We saw the week of April 25th end with 680,000 weeks of unemployment claims. WBEZ reported angry people showing up at unemployment offices. What's the latest on staffing and capacity at IDS, and how big is that backlog?
I think I reviewed this yesterday, but I'll try to repeat some of it today. First of all, there is not a backlog in the sense of people have filed something and it's not officially filed. People go online, they create an account, and they fill it out, and that is then a filing. People call up and file with somebody over the phone, and that becomes a filing. So, it's sometimes hard to tell exactly how many people are waiting. What we know is how many that we're processing at IDES on a regular basis, and that number has significantly increased. As the weeks go on, as you can imagine, more and more people are filing. Our rate of filing, as I say, has gone up. Our rate of processing, rather, has gone up, and so there is. We are reporting to you kind of what we know about the incoming and what we're able to reveal about the incoming processes. We have increased the frontline staffing answering the phones. We have increased the number of people who are working behind the scenes on the IT systems and increased the amount of work. We have outside contractors that are continuing to make sure that that system is up and running as much uptime as possible. It is still this 10-year-old system that's been bolstered, from underneath. But in the end, we're going probably to have to replace the system. Significant improvements need to be made in the future, but it won't be able to happen during these first months of the coronavirus outbreak.
This will be our last question from Christine at NPR. If someone is sick with COVID symptoms but not severely ill, is it better for them to just stay home and not get tested for COVID-19 in order to conserve tests for those who may be higher risk, or should they get tested? That's for Dr. Ezike.
So again, if someone was exposed to someone who was laboratory confirmed to have COVID and then they develop similar symptoms, I guess it's not a big stretch to guess that that person has COVID also. Obviously, they would qualify to get tested if they want to be tested, but if they're not in the high-risk category and are able to stay at home, they're able to care for themselves, if they're able to connect with a medical provider and just check in case the symptoms did progress, that is fine. If the person wanted to know for sure to be added to the count, that is fine too. So it's not a directive in terms of what the right way to proceed. Either is fine, but the most important thing is probably to talk with the medical provider and make sure that you're sharing your symptoms so that we can make sure that there's not a point where the symptoms progress that needs acute medical care. But if you're fine and you're healthy and you stay home and isolate and identify people who you may have been in contact with even 2 days before, let those people know so that they can be aware that they have been exposed and that they might need to stand down because they potentially will show some symptoms. So that part of the self-contact tracing, if people are able to help identify people who they have exposed, that's really helpful to alert other people that they need to be watching out for the development of symptoms.
All right, thank you, everyone.
Thank you.
Governor Pritzker's COVID-19 briefing, 2,450 new cases in Illinois. That high number, the governor says, reflects a higher number of tests. Altogether, 58,505 cases. 105 people have died since yesterday in Illinois, 2,559 deaths in Illinois since the beginning of the pandemic. The governor, again, urging you to wear face masks even if you think you are 6 feet away from someone. Mayor Lori Lightfoot is going to hold a briefing at 3:45. We will bring that to you as well, and we will have all of the day's news on our news at 5 o'clock. I'm Jim Williams. Have a good afternoon.
This has been breaking news from CBS 2.